I'm now thrilled to introduce our three panelists today, three professionals who bring unique perspectives to our discussion about diabetes science and healthcare. Welcome to Dr. Lisa Duran. Dr. Duran is an endocrinologist, board certified as well in obesity medicine, with an expertise in all aspects of endocrinology. She's co-founder of Pink Coat MD, a safe professional community supporting the emotional well-being of women physicians. Dr. Duran earned her bachelor's degree at Brown University and her medical degree as well at Brown Medical School. There, she was awarded a one-year fellowship at the Joslin Diabetes Center with Harvard Medical School to introduce to further her interest in diabetes. She went on to complete internal medicine residency at Santa Clara Valley Medical Center, an affiliate of Stanford, in her hometown, San Jose, California, and was the recipient of the Bender's Fellowship supporting diabetes research and care for underserved communities. After finishing her fellowship, she returned to the Bay Area, where she practices clinical endocrinology at the John Muir Medical Group, affiliate of the UCSF Medical Center, and she served as chair of the Northern California ADA. Next, I'd also like to introduce Dr. Erin Neinstein, Associate Professor of Medicine at UCSF, leading the Digital Patient Experience team at the UCSF Center for Digital Health Innovation. Dr. Neinstein is also the VP of Digital Health at UCSF Health. His digital health resume spans leading UCSF's ambulatory Epic electronic health record implementation development, as well as deployment of numerous digital health solutions, transforming digital patient experience and virtual care delivery across UCSF, research and advocacy, and advancing U.S. health policy, federal health policy, and operability and patient data access, as well as co-founding of Tide Pool, a nonprofit creating open source software to empower people with diabetes. Dr. Neinstein is an inaugural inductee as a fellow of the American Informatics Association, board certified in endocrinology, clinical informatics, and internal medicine. He maintains an active clinical practice focused on the care of people with diabetes and was named by Marin Magazine to the top 2020 Bay Area doctors list. And finally, I'd like to welcome Dr. Janet McGill. Dr. McGill is a professor of medicine in the Division of Endocrinology, Metabolism, and Lipid Research at Washington University School of Medicine, and attending physician at Barnes Jewish Hospital in St. Louis, Missouri. She is currently the principal investigator of the NIH-funded GRADE study and insulin-only bionic pancreas pivotal trial. Dr. McGill has conducted over 220 clinical trials in type 1 and type 2 diabetes, studying new treatments and complications such as hypertension, hyperlipidemia, nephropathy, neuropathy, and retinopathy. She was the principal investigator of the NIH-funded PEARL study preventing early renal loss in type 1 diabetes, and a CGM sub-study, also the recently published WISDOM study. She led the Washington University site for the Type 1 Diabetes Exchange Clinic Registry and was the PI for several Type 1 Diabetes Exchange trials and registry studies. Dr. McGill has served on steering committees and data safety monitoring boards for long-term outcome studies. Welcome to our group, and thank you so much for joining us today. I want to give you each a moment to say hello and ask any questions you have of our fellows for them to answer in the chat, and then we'll sort of have a conversation together about career paths. We'll start with Dr. Duran.
Sure. Hi, everyone. My name is Fluvisa Duran. I'd like to thank the ADA for inviting me on this wonderful fellows program. I actually didn't have this opportunity when I was a fellow, and so I'm really thrilled to be here to speak to you all about my experience in clinical practicing for close to 10 years now. I'm in my 8th year in community practice, where I see close to 100 patients a day, mostly diabetes. And I'm just really excited to share with everyone my insights and personal experiences being an endocrinologist and taking care of a lot of patients. And I guess my question for the audience is, I'd love to hear in the chat box who is, maybe you can give me a sense of what you're planning to do after fellowship. Are you planning to go into community practice? Are you planning to stay an academic? Are you planning to do research? I'd love to learn a little more about your interests.
Thank you so much. That'll really help us tailor our discussion too. And Dr. Neinstein, tell us a little bit as well about your thoughts.
You're on mute.
There we go. Sorry, I muted myself. It didn't let me unmute. Really nice to be with everybody. Appreciate the invitation. As Louisa said, I feel like when I was a fellow, didn't have this kind of opportunity for really learning about all of the different types of career opportunities that are available. I think it's very easy when you're training in an academic environment to be exposed to only a very small amount of what's out there in the world in terms of opportunities. And so would love to, engage in the dialogue here about the full spectrum of opportunities that are out there. My path, as was introduced, was really coming up through informatics and implementing our electronic health record, some entrepreneurial time developing a digital health nonprofit company, and now leading our digital health teams at UCSF. And I think what I would love to understand from you all, and Bob sort of started this conversation in the last segment, is thinking about not what the jobs were in diabetes care 10 years ago, but what do you see as the jobs that there will be in diabetes care 10 years from now? And how are you all thinking about what are the types of jobs that might not exist today that you hope will exist when you're 5 or 10 years into your career?
Fantastic. Thank you so much. And so we are seeing a very nice mix. A lot of our colleagues are interested in academic medicine, although I'm happy to see some as well in community practice and FHQCs. And of course, physician scientists as well, which is a great transition also to Dr. Mcgill. Welcome, Dr. Mcgill.
So thank you for the invitation to be here. It's always fun to talk about things that you've enjoyed doing for a long, long time. And I see questions in the chat about how to have a hybrid career. And I want to tell you that that's what many of our careers look like. They're really they're hybrids. So I have clinics. I take care of patients. And then it just happened, I was asked to join the faculty a long time ago to work on the DCCT, and that morphed to other studies. And then it just sort of mushroomed a little bit. And I did a lot of studies with very good coordinators, very good staff people. So I think, first of all, I would use time in your fellowship to get to know your faculty, find out what they have done and how they've done it. And you don't always have as much time with these discussions as you might like. So use the people you've got. Go talk to people that are very right there with you. What are they doing? You should PubMed every one of your faculty. Have all of you done that? Do you know what their interests are, what their strengths are, what kinds of groups they associate with, and are any of your interests aligned with what they are doing? And if so, how to utilize fellowship, but then how to learn how to do that in practice. And whether the practice is an academic center and you want to use a completely interesting skill like Erin you happen to be good at informatics, which is not my skill. I was once told by my son to, Mom, stop calling me. You've got to learn this stuff. So I did learn it. But so if you have a particular skill like Erin, well, go for it. If you're good at statistics, or if you're good at writing, or if you're good at journalism, or if you are simply good at or really have a passion for some aspect of diabetes care, like diabetes in pregnancy, or technology, type 1 diabetes, or obesity, well, follow those passions and become an expert, and then and then just kind of go for it. Most of us have had to carve our places. We had to do carve outs. There isn't another person exactly like me at WashU. And there won't be another person exactly like Erin at USC. And Louisa has carved out her practice, and developed it in the way that the way she wants to see it happen. So you got to make it happen.
Thank you, Dr. McGill. That's great advice. I think, again, that theme of being your own advocate, you may end up paving the road that isn't there, and finding the right mentors that can help along the way. So I want to kind of, this is a question for any one of you, all of you, regardless of what you're doing, do wear multiple hats. And what's one of the challenging parts of that? That you've learned to kind of manage? What's some advice for that for our fellows as you move on in your career, especially?
I'll take a stab at that because I think this is a really important point that I wish was emphasized to me earlier as I was graduating from training and entering real world practice. I love that the theme on our panel is that we do wear multiple hats, and we have, as Dr. McGill talked about, created hybrid careers. We've become advocates. Erin and I have invested and drank the Silicon Valley Kool-Aid and have gone into our entrepreneurial paths to start, new organizations to really advance medicine and healthcare. And, I think the bottom line is that we really need to be changing the conversation from, all of the different personas we have to just the idea that we're integrating work and life now. And it's an integration of, our person, our spirit, the gifts that we have, the talents that we bring to the world. And so, when you choose to do things, just remember you're fully integrated as a person. So I get a lot of questions about how am I doing at all, right? How am I chairing a community leadership board? How am I having full-time clinical practice, seeing tons of patients as an endocrinologist, mother of 3 kids, starting a company, and all of these things. And I think at the bottom line, you have to remember what you love to do ultimately drives who you are. So I am the best person at home when I am working full-time as a clinical endocrinologist. I'm the best clinical endocrinologist when I am working my creative mind, starting an entrepreneurial endeavor. I am the best friend when I am fueling, my life at home and being a mom. So I think if we can think about integrating everything together as one person, whether it's academic research, community, doing digital technology, all of those things, all of that feeds into your true self and your energy. And that's going to drive you forward in whatever you do. And that's going to help you advocate for the things that you want to accomplish in your lifetime.
I couldn't agree more. I think finding the synergies and integrating who you are is so critical. It's sometimes can feel like early in your career that, every opportunity is a great one. you'll find very quickly that you have many, many more opportunities than you know what to do with. And so finding the places where there are synergies and where you're taking on one thing that's serving multiple purposes for you, I think is really critical. So totally agree with Louisa's point about integration.
Thank you. And let's transition a little more to your unique individual path. So Dr. Neinstein, tell us we're talking a lot about telemedicine as one aspect of digital health, but we know there's many other parts of informatics and things. So tell us a little bit about how fellows can get involved if they want to learn more, and what an informatics fellowship looks like.
Yeah, thanks for the question. So there are the good news and bad news about informatics is it is a collection of lots of different disciplines in one, which can make it feel kind of confusing, but it also means that there are so many different career paths you can take. And there are now informatics fellowships and training programs that are typically 2 years. I think now there are some places where they can do a 1-year add-on on top of another ACGME fellowship. And those prepare you to be board certified in clinical informatics. Informatics can be a little bit of data science, a little bit of analytics, a little bit of clinical research, a little bit of culture and change management, a little bit of leadership, a little bit of design and user interface. And everybody within informatics has a slightly different flavor to what their practice is. And I think for what, something that Bob said in the last session, I think really resonated, which is diabetes is a window to healthcare. And so anything you do in diabetes becomes an opportunity to say, this is a template, or this applies to so many other places in healthcare. And so I think it's the same thing in informatics, where you can have the opportunity to either be an endocrinologist in there are lots of people now who are becoming endocrinologists that work in a digital health company. So you are a clinical endocrinologist, but you're practicing largely via digital means, working at a company like Livongo Teladoc or Omada Health or Onduo and other companies like that. You can become a product designer or a product developer, where you are starting a company and you're really building a core product. You can become a chief medical informatics officer, where you're really responsible for the electronic health record and all of the clinical information systems within a health system. You can become a leader within your diabetes practice or your endocrine division in utilizing informatics tools for better clinical care and quality improvement. You can become a clinical researcher who excels at pulling data out of electronic systems and doing clinical research on it. So I think what's exciting about it is that there are so many different paths that you can take. And I think, as I said, I think in the coming years, there's gonna be more and more opportunities across this space.
Fantastic, thank you. And that's a good transition to discussing clinical research with Dr. McGill as well. You have this wealth of clinical trial experience. One of the challenges for fellows is that clinical trials are often, require more time than fellows have during their training. And so what are some ways you've involved your fellows, in clinical trial experiences during their training?
Yeah. Well, we'd like them to see, feel, touch everything.
Yes.
And we have fellows that some take a hold of the trial and really become managers of that trial. And then we have fellows who, will see patients and learn the trial and learn about the trial. What I would suggest is, if you have an opportunity, sometimes you can even limit your time involvement. You can see a few of the patients. You can be helpful in a lot of ways. Get a hold of the protocol and look at it carefully. you need to understand what goes into a clinical trial protocol in case you ever want to write one, in case you ever want to think about doing something on your own. You need to read and catalog a couple either investigator initiated or NIH funded or industry funded protocols so that you understand what it's about. So I think there are ways to get good experience without an enormous amount of time and being afraid of, oh, I don't have time for this, I don't have time for that, okay, well, I don't know what to tell you. You've missed out on high value experiences that may or may not have taken that much time. And, we spend so much time and focus on teaching the intricacies of lipid metabolism and pituitary function and diabetes and all of its forms and treatments and drugs and testing, and that people get the feeling that's all there is. I mean, it's a very blindered situation. That's all I need to know. And then something funny happened to me on the way to the forum. Somebody asked me to edit a book on atypical diabetes, but all kinds of other forms of diabetes really made me think it's like I don't know enough about these. And now we're doing this atypical diabetes grant. So you need to take advantage of small opportunities and use them as bricks. You got to have bricks. And if all of your bricks are learning about, diabetes antibodies or something, you don't have you'll have medical knowledge, you'll pass tests, but you won't have very many bricks.
Thank you. And Dr. Duran, that, regardless of whether you're doing clinical research or a busy clinical practice and serving on clinical improvement committees and teams, how do you balance, and stay, you mentioned, being the best endocrinologist helps you at home. How do you balance all these demands and stay on schedule and on time?
Right. So I've eliminated the word balance from my vocabulary because as sort of spoke about earlier as well, I do think of life as synergy and integration. So, when we use the term balance, there's this notion that something is competing for another thing. And if you don't do one thing, it's taking away from the other thing. And so part of what I think helps keep my energy level and my passion alive through, the years is knowing that everything is feeding one thing. It's all integrated. In terms of, practical matters, get clinic, because as an endocrinologist, if you go into community practice, you will have a huge productivity pressure to see, complicated patients within 20 minutes, 8 to 5, Monday through Friday. That's close to 100 patients a week. And we've got a time crunch to do a lot of care in a short amount of time. And it just seems like it's getting shorter and shorter and shorter. So practical tips for staying on schedule in these high demand productivity markets, I would say, is it's going to come down to one, delegating. This is something I didn't learn as a fellow. I thought I had to do everything on my own. I was a perfectionist. If I couldn't do it, then it wasn't going to be done as well. And I didn't really have help to hand off tasks to. When you're out of fellowship, you're going to be your number one priority is coming up with a care plan for your patients, doing high level work, and a lot of tasks like returning phone calls, mailing letters, any sort of administrative task. You use your medical assistant, use your office staff, delegate. And that works at home too. I delegate to my husband and family members. I even delegate to my 6-year-old child. you put your shoes on. So that's huge. We're not taught that as fellows. We're not taught that in medical school. We're taught to do everything on our own. So I believe delegation is huge. Start practicing that today. And then I would also say, keeping on schedule, you got to stay focused. So maybe with the complicated patient who has multiple problems, focus on one high impact health issue, address that, and then get the patient in for a follow-up visit. And this is sort of how we've got to do it. Utilize technology. Big thanks to Erin, who brought out Tidepool and is bringing in the technology, which is making telehealth a lot easier, especially for the care of patients with type 1 diabetes. This is all, such an improvement from when I started practicing back in 2013. And so use technology as your friend. That helps keep you on schedule too.
I really love that concept of synergy, and I can see some of our fellows are loving that as well. I think a lot of this, again, boils down to speaking up for yourself, delegating, and seeing where you can, help yourself, help others.
Yeah, and I see someone in the chat box commented about how balance makes that person feel guilty. This is so true. I can tell you, and the guilt is heavy. It weighs you down. I think as physicians, we have invested so many years in developing our minds and our talent. We need to keep light. We can't let the guilt get us heavy, because what happens then is we lose our creativity. And when that creativity goes, we cannot innovate. We cannot do the research. We cannot create. We cannot, ask those really important questions that really help propel our field forward. So let go of the guilt. Work on integration, work on synergy, delegate, keep your mind light, stay in flow.
It is really disappointing that we're actually already at the end of this session. We could easily talk with each of you for an hour and still have more to ask. So I want to thank you so much to our panelists for showing us that you can have synergy, you can create your own path, and that there are multiple different pathways to doing diabetes care. I know we have a nice question for Dr. Neinstein as well. Unfortunately, I think just in needing to move forward, I'm going to ask if you wouldn't mind making a brief comment here. We can go over just a minute or so. I think this is an important question. Any other questions? So we might do by chat. And I want to thank you all so much for taking time out of your Friday afternoons to be with us.
Thanks. So let's see, I'll try to be quick. I think one is definitely feel free to explore because there are a lot of opportunities out there, and a lot of these companies are looking for specialty help and advice in diabetes. I think 2 is be careful and make sure you are advocating for yourself and have good advice from someone who either knows what they're doing or a lawyer, because you do want to be careful about making sure you don't get taken advantage of. There are a lot of startup companies that can sound very exciting, and it is easy to get taken advantage of if you're not careful. And I think the third piece of advice would be to, again, I think about what you want the future to look like, rather than looking for what a role might have been 5 years ago. The future is changing very fast. And so think about where you want to be in 5 years and advocate and look for opportunities to develop into where that's going.
Thank you so much. And I think that translates to some of the clinical research as well, sort of, starting with your long-term plan. I really appreciate all of you. And I think we're gonna continue this.